Hi students, we are going to continue our discussion on the cardiovascular system as we dive into the part 2 of chapter 5. We're going to spend some time talking about blood pressure regulation. Blood pressure, simply put, is the push that the blood has against the walls of the blood vessels. You've all seen a water balloon, you've all seen squirt guns and how fluids can push against the surface. Our blood vessels have a surface that lines them, and as the blood pushes against that surface, it causes our blood pressure. Generally speaking, we measure the blood pressure in the arteries of the arm, but it is possible to measure the blood pressure in other parts of our bodies. Something that's worth emphasizing is if you go from the arm to the leg, to the foot, to the wrist, as you measure the blood pressure in different parts of the body, the standardized values of the blood pressure for those different parts of the body are going to be different from each other, because as we go up or down up with gravity or down up against gravity or down with gravity, blood pressures are going to change in our bodies. Our high blood pressure corresponds to the heart ventricles contracting, particularly the left ventricle contracting. And when the left ventricle is in systole, that generates our systolic blood pressure, and that's caused as blood is being squirted from the left ventricle through the aorta of the heart, the aorta of the heart. Our low blood pressure corresponds to when the left ventricle is in systole or relaxing, and that is our diastolic blood pressure. Generally speaking, for a typical average human, the cutoff between regular and above average or pre-hypertensive is going to be 120 millimeters over 80 millimeters of mercury, the systolic over diastolic blood pressures. And this blood pressure is controlled by the arterioles, those small blood vessels that have lots of smooth muscle in them. To measure a blood pressure, you use a sphygmomanometer. That is the official name of the instrument that measures blood pressure. Most people struggle with saying sphygmomanometer, like I do. So they'll say something that's a little bit easier to pronounce. They'll say blood pressure cuff. And that's generally speaking a lot easier to pronounce. Now when you're measuring a patient's blood pressure, what you're going to start off with is by pumping up the sphygmomanometer up to a high pressure, and that completely pinches off the artery, and you can't hear any blood flowing through it. And as you have your stethoscope right there by the major blood vessels, the moment the blood vessel pops open and you can start hearing some blood flowing through it, that corresponds to the systolic blood pressure. So as the reading on the pressure gauge goes down, 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 the moment you start to hear the noises, that is when you have your systolic blood pressure. And then the moment that you stop hearing the noises, that's your diastolic blood pressure. And for a typical healthy adult, you'll start hearing noises at about 120 millimeters of mercury, and you'll stop hearing them at about 80-ish millimeters of mercury. So if you are at the 120 over 80, you're normal. If you're below 95 over 50, you're hypotensive, you have low blood pressure. And if you're above that 120 over 80 mark, you're going to have some variation of hypertension or high blood pressure. If you are working with somebody who has a blood pressure over that is 180 over 110 or higher, you need to get them to the emergency room right away, and you need to have them just lie down and relax. And hopefully not stress them out. This blood pressure is very closely or intimately related to our blood flow through our bodies. Blood flow is going to be the highest under the highest blood pressure. So as we'll have the most or highest velocity or the highest rate of blood flow in the blood vessels that have the highest blood pressure, which are going to be the arteries of our bodies. In the capillaries, we have a much slower blood flow because there's a much larger cross-sectional area of our capillaries, and this allows for much higher nutrient and gas exchange to occur from the blood in the capillaries to the interstitial fluid outside of the capillaries. And then within the veins, there's very, very low blood pressure. The blood pressure is almost zero in the veins. So a good clue that you can have between an artery bleed, an arterial bleed, and a venous bleed is that if you have squirts of blood, periodic squirts of blood, you probably have punctured the artery. And if you have a constantly oozing wound, you have capillary or venule damage. So if we look at our blood pressure in our arteries, and That blood pressure goes up, down, up, down, up, down, as the left ventricle contracts, relax, contracts, relax. And then when we get to the capillaries, there's a very, very high cross-sectional area of all these tiny little capillaries combined, which causes the blood pressure to equal out and the velocity to drop down very low. And then as cross-sectional area decreases in the veins, venules, the velocity will go back up again. To help our blood move through our veins, we need something to help increase the pressure. Notice that the pressure in our veins is very low relative to the pressure in the arteries. So to help increase the pressures, we have skeletal muscle pumps. These skeletal muscle pumps are going to be bulges of skeletal muscle tissue that press against the veins as we contract the skeletal muscle tissue, and then as we relax the skeletal muscle tissue, we allow that chamber within the veins to fill back up again. When I contract skeletal muscle tissues, those muscles bulge against the veins and force blood through the one-directional valves towards the heart. Something else that can help us move blood through our veins is breathing. When you inhale, you have very low pressure in your thoracic cavity. And that low pressure causes air to rush into your thoracic cavity, and it also causes blood to rush into your thoracic cavity. So when you take a deep breath, in addition to pulling air into your chest, you're also pulling blood into your chest. Concept check, class. What is the primary cause of varicose veins? Would it be a lack of skeletal muscle? Would it be inactivity? Would it be pregnancy, weight gain, or would it be broken venous valves? You can go ahead and rewind this video, check your textbook, or check the chapter. Please get me an answer. 5, 4, 3, 2, 1. The primary cause of varicose veins are those broken venous valves. So D is the best answer. Now there are risk factors that can increase the likelihood of breaking the valves in our vein. Some of those risk factors include inactivity, lacking skeletal muscle tissue, and then pregnancy or rapid weight gain. One of the primary reasons why you see more varicose veins in heavyset females compared to heavyset males is females in general don't have as much skeletal muscle tissue compared to males. Also, females are much more likely to have rapid weight gain from pregnancy, so that's a bit, and that as the uterus is swelling, that is going to cause pressure to build up on the veins of the abdominal pelvic cavity, which can decrease circulation from the lower extremities, increasing the likelihood of those venous valves breaking down and triggering varicose veins. So the primary cause is the broken valves, but A, B, and C are risk factors that increase the chances of breaking those valves. Now, there are two pathways that the blood can travel in our bodies. The primary pathway that most people think about is the systemic pathway. And that systemic pathway or systemic circuit is going to be the large one that sends oxygenated blood to most of the tissues of our body. But there's a pulmonary circuit as well. Pulmonary is a fancy or technical term that means lung. Sometimes plural or pleura can also be used. The pulmonary circuit is going to go from the right ventricle of the heart to the lungs, back to the left atrium. So during the pulmonary circuit, we'll send deoxygenated blood from the right ventricle to the lungs, where it picks up oxygen and comes back to the heart at the left atrium. The systemic circuit starts at the left ventricle. Oxygenated blood leaves the heart, goes to the tissues of the bodies, and then loses its oxygen and comes back to the heart at the right ventricle. In our bodies, we have many major blood vessels. These major blood vessels are typically going to be named for structures that are nearby. Typically, there's going to be an artery and a vein, a corresponding artery and a vein that have similar names. For example, we have femoral arteries and femoral veins. They are both by the femurs, which are the long bones of the thigh. We also are going to have subclavian arteries, subclavian veins. They're both beneath the clavicle. There are a few differences, though, between the arteries and veins, particularly around the heart, where we need to have some structural differences to make up for the double pump structures of the heart. As we are moving blood through the coronary, or excuse me, through the systemic circuit. A subset of that systemic circuit is the coronary circuit. The coronary circuit, or coronary circulation, is a subcategory, small subcategory within the larger systemic category. And these coronary arteries are going to branch off of the aorta and send oxygenated blood to the tissues of the heart. Another portion of the systemic pathway, that or subcategory of the systemic pathway, is the hepatic portal system. Our hepatic portal system is going to take blood from the intestinal tract and send it directly to the liver. Hepatic, or hept in this context, is a technical term that means liver. So if we take the blood from our small intestines and large intestines right after we've absorbed nutrients from those intestines, we're going to send that blood and the nutrients the blood has absorbed to the liver. Why do we do this? We do this because the liver detoxifies our blood. Our liver can take the toxic chemicals that we may have potentially just ingested and detoxify those chemicals before they're sent back to the heart and then to the rest of the body. This is one of the main reasons why heavy drinkers or alcoholics have very poorly functioning livers. That the blood that goes from the intestinal tract that contains lots of alcohol is immediately and first sent to the liver to be detoxified. So the liver is going to be the hardest hit organ if you are working with an alcoholic. Our liver is also going to synthesize blood proteins like albumins and globulins and some fibrinogens, and these blood proteins are going to help us with our blood clotting cascades, and we also are going to use our liver to store complex carbohydrates in our bodies. If we have high blood sugar, too much blood sugar, we can store extra blood sugar in our livers in the form of glycogen, which is an animal complex carbohydrate. After blood leaves the liver, it's going to go from the liver to the inferior vena cava and then back to the heart. So, class, concept check. Which is the largest branch of the circulatory system? The pulmonary, systemic, hepatic, or cardiac branch? You can go ahead and rewind the video, or you can pause it, check your notes, check your textbook, get me an answer. 5, 4, 3, 2, 1. The correct answer is systemic. Systemic is a large umbrella term that includes both hepatic and the cardiac branches within it. Let's continue on. Let's talk about exchange at the capillaries. We are going to have both fluid, gas, and nutrient exchange occurring within our blood capillaries. Our blood capillaries are going to absorb and they are going to release chemicals. Generally speaking, on the artery side, where we have the higher blood pressure, we have a net movement out of the blood capillaries. But as we get towards the venous side of the spectrum, where there's lower blood pressure, we'll have a net movement of fluids into the blood capillaries. Within the systemic circuit, we find, generally speaking, that the blood capillaries are going to lose oxygen and pick up carbon dioxide. And, generally speaking, they pick up wastes, lose amino acids, and lose glucose. The exception is at the intestinal tract. At the intestinal tract, our blood capillaries are going to gain amino acids and gain glucose, in addition to gaining wastes and carbon dioxide. There are two pressures at play here that go back and forth. We have our pulling osmotic pressure that pulls fluids into the bloodstream, and then we have the hypostatic or blood pressure that pushes fluids out of the bloodstream. Now, near the artery side of the spectrum, or closer to the heart, we have higher blood pressure, so we have a net movement of fluid out of the bloodstream. But farther away from the heart, on the venous side of the spectrum, the blood pressure or hydrostatic pressure is really low, and the osmotic pressure is much larger because there's been more nutrients absorbed or more particles of chemicals absorbed into the bloodstream. So we'll have a net movement in near the veins and a net movement out near the arteries. Around our capillaries, we have many lymphatic vessels. These lymphatic vessels form lymphatic capillary beds. We are going to absorb excess fluid that leaks out of our blood capillaries into our lymphatic system. The moment we go from the interstitial fluid and take that interstitial fluid and suck it up into the lymphatic capillaries, we rename it lymph. Then the lymph will flow through the lymphatic capillaries through the lymphatic vessels and be dumped back into the veins of the chest. And then that fluid will re-enter the circulatory system. Something else that's worth emphasizing is that at our blood capillaries, we have precapillary sphincters. And these precapillary sphincters can selectively contract and relax. And this will allow us to redirect the flow of blood between different capillary beds in our bodies. We can see our precapillary sphincters right here. This precapillary sphincter can pinch and prevent blood flow through a capillary bed, or redirect the blood flow through a capillary bed. And we can see that there are lymphatic capillaries intermeshed with the blood capillaries, so that as these blood capillaries are losing excess fluid, that excess fluid can be picked up by the lymphatic capillaries. So, concept check, class. Why do lymphatic vessels intertwine with blood capillaries? Is it A, capillaries are the most common blood vessel? B, arteries have too high blood pressure? C, veins have too low blood pressure? Or D, most fluid leaks out of the blood vessels through the blood capillaries? You can rewind the video, you can pause it, check your notes, or pause it and check the textbook. Please get me an answer. 5, 4, 3, 2, 1. The correct answer is D. Most fluid will leak out of the blood vessels through the blood capillaries, and since that's where most of the fluid is leaking out of our cardiovascular system, that's where we're going to need most of the lymphatic capillaries to suck up that excess fluid. Why is cardiovascular disease a big deal? Why do we care about cardiovascular disease? CVD, cardiovascular disease, is the single most common cause of death within the Western world. And when I say Western world, I'm referring to developed countries or urban countries. So you as students here at Southeast State are going to be dealing with patients primarily within the country of America, which is a westernized country. And we have many, many people who die of cardiovascular related diseases within the United States. It's the #1 killer. Some subcategories within cardiovascular disease include hypertension, aka high blood pressure. We also have atherosclerosis, stroke, heart attack, and aneurysm. So let's spend some time talking about each of these. Hypertension, or high blood pressure, causes blood to move very quickly through the blood vessels. Oftentimes, this is due to the fact that the blood vessels have narrower openings that are caused by plaques building up in the inside of the arteries. High blood pressure is formally defined as any blood pressures above 140/90. That is hypertensive. It's a very silent killer because there's very few symptoms most of the time when somebody's hypertensive, but that very quick moving blood through the blood vessels will oftentimes dislodge these plaques and cause heart attacks, strokes, or kidney failures in the patients. Atherosclerosis is the excessive buildup of plaque in the blood vessels. Atherosclerosis and hypertension, generally speaking, go hand in hand with each other. And if that clot or plaque is stationary, generally speaking, we call it a thrombus. But that plaque can cause a blood clot that will dislodge and move to a distant site. When that happens, we rename the clot a embolus. The stationary clot is a thrombus, and the clot that has moved is an embolus or embolism. A very common spot for an embolus to lodge is in the lungs, and that's why you'll hear the term pulmonary embolism, very common. A pulmonary embolism is a blood clot that started somewhere else in the body and got stuck in the lungs. A common spot for a thrombus to occur is the legs, particularly the lower legs. Atherosclerosis goes hand in hand with hypertension and strokes and heart attacks and aneurysms. Here is a picture of the plaques building up in the blood vessels, causing the lumen or the inner lining of that blood vessel to be narrower, which causes the blood flow and blood pressure to speed up. A stroke is sometimes also referred to as a brain attack, or more technically, a cerebrovascular accident, a CVA. And if you're looking at a medical chart, a cerebrovascular accident is a stroke. These are typically going to occur whenever an artery within the brain is blocked off or burst. A heart attack is when an artery within the heart is blocked off or burst. A stroke is when it occurs in the brain. And once this happens, some of the brain tissue will die because it doesn't have enough oxygen to allow it to survive and produce enough ATP, adenosine triphosphate. some of the symptoms of strokes are going to include numbness and appendages and extremities. And generally speaking, these are going to be asymmetrical symptoms. So it'll happen on one side of the body, but not the other side of the body. So there can be numbness in the face, there can be an inability to see out of one eye, or one side of the face can start drooping. There's oftentimes confusion or disorientation or difficulty speaking, and these are going to be very sudden symptoms. And if you see a patient or come up on somebody who's disoriented and one side of their face is limp and the other side is not limp, that's a big red flag that you have a patient who is currently experiencing a stroke. As I mentioned before, a heart attack is caused when part of the heart tissue dies from the cardiac tissue or cardiac artery being blocked off. A technical term for a heart attack is a myocardial infarction. Remember or recall, infarction is when tissue dies from tissue death. Myocardial infarction is muscle tissue of the heart dying, or it's a heart attack. This myocardial infarction is oftentimes going to be associated with pain in the chest, angina pectoris. This is pain that's going to start in the chest, and in many patients will radiate down their left arm. And this starts because the patient has a blocked coronary artery. And then finally, we have aneurysms. An aneurysm is when a blood vessel in the body swells up like a balloon. Aneurysms are ticking time bombs. They are blood vessels that are ready to pop. Atherosclerosis, the buildup of plaques in a blood vessel, and high blood pressure, hypertension, are two factors that increase the risk of aneurysms developing. And generally speaking, the abdominal artery and arteries that lead directly to the brain are going to be most commonly affected and cause these aneurysms. Depending on whether or not there may be valve malfunctions of the heart, you could have the aorta or the pulmonary trunk also form an aneurysm as well. How do we treat these disorders of the blood vessels and bloodstream? Well, one thing we can do is dissolve blood clots as they form. TPA is a very specific drug that has been designed to help dissolve clots by speeding up the clot dissolving cascade. If the artery's been clogged, we can have some surgical interventions. We can bypass the artery with a bypass surgery. And if you can think of a bypass surgery as our detour or rerouting the blood through a new blood vessel that you sew in place to go around the blockage. We can also use a stent. A stent is going to be inserting a small wire mesh into the blood vessel that props it open. Or we can use an angioplasty. An angioplasty is a technique where you insert a balloon into the blood vessel and then inflate the balloon to pop the blood vessel open. Many times, the stent will be wrapped around the balloon, and you'll push the balloon and stent in place, inflate the balloon, and cause the stent to pop open, and then deflate the balloon and pull the balloon out and leave the stent behind. Here is an example of a bypass surgery. So let's say we have a blockage right here in the blood vessel. You can reroute blood past the blockages from the aorta downstream on the cardiac arteries. If somebody has a blocked artery, you can also shove the balloon, also known as the angioplasty, into the artery, inflate the balloon, and leave a wire mesh behind. Leave that stent behind to leave the blood vessel propped open. Some disorders that occur if we do not treat the heart is heart failure, or if we do not treat these blood pressure and cardiovascular problems is heart failure. Heart failure is when the heart's no longer pumping blood appropriately. Sometimes you can treat heart failure with the left ventricular assist device, an LVAD. Another possible treatment is a heart transplant, and we can have an artificial heart transplant or a natural heart transplant. Artificial heart transplants are the new kids on the block. They're kind of complicated in that the patient is going to need to wear battery packs to power the artificial heart that is in their chest. And they are going to use a wireless charging system that will transmit energy from the battery packs outside their body to a receiver on the inside of their body to recharge the batteries on the inside of their body. To help prevent cardiovascular disease from developing, There are some lifestyle changes you can make. You can refrain from the use of tobacco products. Don't smoke. You can not abuse alcohol or other drugs. You can avoid being obese. Keep your weight down. As you grow larger and larger, every pound of body fat that you put on your body adds miles of blood capillaries that your heart needs to push harder to move the blood through. You can also avoid sedentary lifestyles. Make sure that you get at least a half an hour of physical activity every single day. Eat healthy is another, or a healthy diet can also help you avoid developing cardiovascular disease. Avoid being stressed out all the time. Just relax. When you're constantly stressed out, you are causing your blood pressure to be raised. You're causing plaques to develop in your bloodstream. Constant stress is terrible for us. And then finally, take care of your teeth. Poor dental hygiene is correlated with heart disease. Individuals that have poor dental hygiene have higher amounts of bacteria that enter their bloodstream through their gum line, and that bacteria that's entering their bloodstream is known to cause a thickening and hardening of the valves of the heart. So, class, concept checked. What is the difference between a heart attack and a stroke? Is it A, the tissue type that dies, B, one has a blocked blood vessel and the other does not, or C, one has a broken blood vessel and the other does not? You can rewind the video, you can pause it, check your notes, or pause it and check your PowerPoint. Please get me an answer. 5, 4, 3, 2, 1. The correct answer is A, the type of tissue that dies. During a heart attack, we have cardiac muscle tissue that dies, and during a stroke or a cerebrovascular accident, we have brain or nervous tissue that dies off. And that's all we have for this chapter. If you have any questions about this material, please feel free to email me, ask me a question when you're on campus, or post the questions to the discussion board. Happy studies!